आपल्या मराठीमध्ये एक म्हण आहे, पुढचा स्टेज मागचा शहाणा. समजा तुम्ही एखाद्या जर्नीला जाताय आणि तुमची ती वाट आहे खूप अनोळखी आहे आणि तुम्हाला माहीत नाही त्या वाटेमध्ये काय खास कळगे असतील का किंवा कुठे काटेकुटेरी असतील का, आणि तुम्हाला तिथून एक माणूस येताना दिसतोय. तुम्ही त्या व्यक्तीला थांबवणार आणि विचारणार की हा जो रस्ता गेलेला आहे तो कसा आहे, आणि ती व्यक्ती तुम्हाला त्या रस्त्याबद्दल सविस्तर माहिती सांगणार. नमस्कार मित्रमैत्रिणींनो, माझं नाव डॉक्टर संध्या गव्हाणे आणि माझ्या ह्या चॅनलमध्ये तुमचं सगळ्यांचं स्वागत. मित्रांनो, मी एक कॅन्सर सर्वायव्हर पण आहे. आज मी तुमच्यासाठी एक पॉडकास्ट घेऊन आलेली आहे. बरोबर ओळखलात तुम्ही. आज मी एक कॅन्सर सर्वायव्हरसोबत पॉडकास्ट करत आहे. ही जी कॅन्सर सर्वायव्हर आहे ती एक डायटिशियनसुद्धा आहे. म्हणजे आपल्याला नुसते त्याचे अनुभव पण नाहीत, पण एक चांगली माहिती आणि चांगला एक तुमच्यासाठी उपदेश, मेसेज त्यांच्याकडून मिळणार आहे. तर चला आपण त्यांचे स्वागत करूया. वेलकम प्रिया. सो प्रिया, आय नो की यू आर व्हेरी एल एज्युकेटेड, सो प्लीज इंट्रोड्यूस युअरसेल्फ अँड टेल मी बिट अबाउट युअर बॅकग्राऊंड.
I'm basically a MSc postgraduate in food science and nutrition, and after that I came married to Mumbai, and as soon as I came married to Mumbai I joined SNDT Juhu Department of Nutrition, where I was working for the Department of Nutrition for various nutrition community nutrition programs. Then later I joined MGM Hospital Vashi as a dietitian. That time it was a 75 bed hospital, and I was one of the earliest dietitian. Only two dietitians were present, so a lot of experience in starting as a dietitian there. Then I went on to doing US medical documentation for, it's an outsourcing job.
Okay.
So where you could work from home. So I got into digital marketing where I worked as a content writer, but all these years I carried my profession, my nutrition job on a side by. Later I joined this NGO called Indian Women Scientists Association, where I could work a lot regarding my profession also, and also for many scientific and academic projects. And later on I got into their core committee, and now I work there as joint secretary of Indian Women Scientists Association.
Good job, Priya. This kind of knowledge and experience we are getting from Priya. We are very fortunate. So Priya, tell me, when and how did you first come to know about your diagnosis?
I was basically a quite healthy lady, even though look-wise I was very thin because of my fast metabolism. After I had my 2 children, no problem. I had a very good family life. But then in my late 30s, I began to have heavy bleeding. This struggled in my 40s. I had to undergo 2 DNCs. So then they suggested to insert a intrauterine device, which is called IUD, to stabilize my
Control
hormones.
the bleeding.
Yeah. But because I was not a very inactive person, not a sedentary person, this IUD slightly displaced itself.
Oh.
In my second DNC, they removed the IUD and they realized that I don't need a IUD. Let us diagnose what is your exact. So the doctor put me on a few months medicine. After that I was all right. But during 2020, during the emergence, I began to observe a small insect bite. A small insect bite. So first thing it came to my mind
Insect
is
bite where?
on my right breast. On
Okay.
my right breast, while I was having my bath, I noticed this. But by then I would have conducted at least 2 or 3 cancer-free cancer detection camp. I was
Through
part
your,
through my
Indian
organization and through my health committee. I was organizing all this, so I am aware what is all this, what are the
Yes,
important
yes.
things. So, but I was alert. I was observing it very well.
Because you are you were
Aware.
aware of that.
I had information.
Symptoms, yeah.
I have enough information about how we should be aware of
breast
it.
cancer.
Yeah. All that I was aware of. And it was it still remained as a stubborn button-like lump.
Okay.
It was only button size. It was a very small lump, no discoloration, nothing. But then I was very busy looking after my aged father, who was in the terminal cancer stage.
Oh, okay.
So I decided, let me go and look after my dad. In Kerala, I will get somebody to diagnose me. By then, I realized this was mobile. It was quite big. It would have reached at least 2. this much it would have reached.
Yes.
So I came back to Mumbai. So in Mumbai, it was locked down. You can nowhere approach a doctor.
I know. These times.
I knew this is something wrong. It is quite big enough. I waited for the vaccine. I read in papers that the vaccine is about to be come in, So then I had my hope in my mind, let me first get vaccinated. Because they won't allow you to, nobody is even allowed to come near anybody.
the hospital.
So I still remember waiting for a whole day for myself to get vaccine. So the day I got, somehow I managed to stand the whole day. I got myself vaccine. The second day, I just walked into a private hospital, straight into them. By then, I was pretty sure there by doing the examination, just the physical examination, and the doctor had told me. And had told me it looks like you are going into the correct. You might be positive. Why don't you immediately go for a scan or whatever they have told me, mammo or something.
Mammography.
So immediately I went into the mammo. There the nurse itself showed me how big it is. By then it had grown. So this all happened between October. Within 3 months.
Within 3 months,
Three
the
months
lump
it had grown.
That aggressive type of cancer
Yeah,
must
it was
be there.
fast spreading.
Fast
it was,
spreading.
It was fast growing.
Growing.
Rather than spreading, it was
It was
growing
growing.
in that particular area.
Same
it was
area.
growing. It was.
By then the nurse showed me, then immediately I was taken to a very good, I must thank my surgeon, Dr. Tushar Jadhav. I really am very happy and I have my full gratitude.
In which hospital?
In Reliance Hospital.
Reliance.
Yeah, so there he explained to me, he saw this and he said, yeah, it is showing all the signs, but I can assure you, you will come out of it. So that remained in my mind.
Okay.
He told me this is completely curable because you are not come too late also. You are in almost in the second stage, towards the third stage, but we can do it. You will be completely. So we will first do a biopsy. Now the biopsy results also took another 10-15 days because of the COVID.
Yeah.
So that by then
The
I
third
started
wave
feeling
has
the
come
pain.
and-
The pain had started coming. I could really feel the pain inside my lump, and I was
It was always.
Any other symptoms are there like
No
weight
other
loss?
symptoms, no weight
fatigue.
loss, because I couldn't be detected because I'm already a thin lady.
Thin lady.
How much can I, become thin?
But fatigue or
Fatigue.
That is one. Thank you for reminding me. Fatigue was there before this insect bite.
Okay.
3,
You
4,
were,
like if I
feeling
take
the-
it as a flashback, I used to feel why I am so active. Why am I feeling so tired?
Tired.
No, otherwise I was eating well, but I used to feel this sudden flash of fatigue coming inside me. Try to rest a lot, and I was tired. So fatigue is something we should look out for.
But the early signs of
signs.
cancer, any
Yeah.
type of cancer, not only
Fatigue.
breast
That's
cancer.
fatigue. It used to remain in my mind. Why am I getting this fatigue? Biopsy and all came. He said, he gave me how the diagnosis will be. I was
HER.
HER2 negative, but ER2 positive.
Positive.
That cancer cells need more estrogen to feed on it. So it will ask for more estrogen.
Estrogens.
And I am not menopausal also. So it is getting estrogen to
Fast.
feed on. That is why that area got
Large.
fast. Yeah. So
I know it's very difficult, Priya. As you say, these symptoms must be noticed by everyone.
Yeah.
They are called early signs of breast cancer or any cancer.
Yes.
This is very sensitive question. But what was your first reaction when you come to know about your cancer diagnosis?
thing that came to me is where did I go wrong? Because I always followed a good lifestyle. I did not have any long hospital stay. So where did I go wrong? That was my question. Then I realized it could be that heavy bleeding stage where that IUD would have triggered.
Yes.
Diagnosed
That
probably.
IUD contains actually hormones.
Hormone.
IUD is called Marina iodine.
Marina
IUD,
yeah.
and that IUD is having hormones
Hormone,
itself.
progesterone and
Estrogen.
both together.
Both is there.
Yeah.
Both are there.
The body would have kind of got confused and one of the hormone would have shot up. This is
Correct.
what I can only think of.
Yes.
Instead of feeling why me, because the doctor said don't feel guilty.
Yes.
That was a very nice advice. He sat with me for 1 hour with me and my daughter. He said don't feel guilty that why you got it.
Like you said, why me? And these questions are very common in
Yeah.
cancer patients. It's okay. Then you tell me what kind of treatment you got for
Yeah.
this breast cancer.
The doctor said we will first remove the tumor.
Hmm.
We will get a scan done whether it has spread anywhere.
PET
so
scan.
both PET scan and MRI, everything was done on me.
Hmm.
They found out it is not spreading type, and he also told me it is not the recurring type also.
Okay.
Cannot recur much.
Yeah.
So this all is giving me confidence, that hope, And so treatment was first we will undergo surgery, and then there will be 2 bags attached to me to once the lymphatic drainage, you will have to remove.
Only the part of the cancer cells has been removed.
removed.
Okay.
And of course the axilla
Axilla.
part.
Okay.
How many nodes that he had told, already he is seeing 2.
Two,
1 or 2 he is doubting. So during the surgery also he will be removing that much of flesh from the area, and from somewhere he will adjust it. So I will always have to be careful with my right dominant hand, because that part, that lymph nodes have been removed. So how
Correct.
many lymph nodes have been affected, they can see already in the mammo, but it is confirmed when it is fully open.
Okay.
So I think 1 out of 9 I had only one. I
One.
think. So the surgery is delayed because the duration of the surgery will be more, because it will go to the lab, they will test it and they will bring it back.
Oh.
Till then I am kept,
It is very important because more than 2-3 lymph nodes involved.
Then the
Directly
treatment
the
will be-
patient will go into stage 3 cancer.
Stage 3 cancer, yes, correct.
Then again the line of treatment will be changed.
Yeah.
Because whenever we are spreading awareness of self-guidance,
Mhm.
self-guidance, it is very important that you press your axilla also.
Axilla.
Women are only checking their breasts, putting their arms up, but they never knew. Even I didn't know that.
Yeah.
So that is where it hides. So you should always press your axilla little
Yes.
bit. If you feel any unwanted pain or little abnormal pain, go to your gynec. Don't get scared to go to the gynec, because gynec will have a solution.
This is the best advice from Priya, because we always check our breast for lump
Yeah.
or any secretions
Yeah.
or any discoloration and all
Yeah.
that. But axilla part is always neglected,
Mm.
because axilla is having all the lymph nodes. So the checking the axilla, any type of swelling or redness or any pain, it should be checked. Very good, Priya.
Decided there's only one, so you will undergo 8 chemo sessions, and then around 15 radiations they said, but during COVID time they had standardized it. Those who are undergoing 15, they will undergo 5 total. They will bring down to 5 high dose radiation.
High dose radiation.
Generally what happens is, by first chemo is difficult, I would say, but
Mhm.
second, third and all, it's not as bad. If we follow I always took a second opinion from another senior. This is also an important point. Even if your surgeon is very good, always take a second opinion from another senior surgeon,
Very
so that you are placing everything, you have your strategy ready.
Yes.
That is also important. So after surgery, you have your lymph drainage. The doctor will wait for the minimum volume of the lymph drainage.
You had a hand swelling?
No hand swelling.
Because
So-
the drainage was proper.
proper. So for that, immediately after surgery, you follow exactly what your doctor says. He wanted to have, the backward kind of a stroke massage.
Okay.
That massage, how much ever you do, it is better. So I did not have to wear any sleeve or anything. Till today I didn't have any lymphatic drainage. So during this time, I should also mention about Dr. Rana from UK. He was husband to my very best friend.
Okay.
So my daughter showed all the results to him. He also told me the same, you have to follow all, this will be your regimen, and I had everything ready. So these are friends who can come like God.
Yes.
He was like a God to me. He had showed me till post treatment what will be my, and where I have to be alert. And this would be the medication after the radiation. This would be the medication. There are many people who will be like gods to you. So
Yes,
you
yes.
have to approach the right people.
Right person.
Instead of just spreading the rumor that usko cancer ho gaya, their anxiety also you should not. Here your emotional healing is very important. The emotional IQ or emotional quotient is very important. It's not only physical and medicine or yoga or exercise. how you are going to take, with whom you are going to share, how much you are going to share. Only my children knew it, not even my parents knew it. Because I didn't want to see my mother's tension on me. When I
your
called,
father was
yeah,
suffering that.
and he's not seeing he thought I'm just wearing for fashion, all
Okay.
these scarves and all. Because, and with my mother I said I'm having some scalp infection. So I'm not sharing I'm not taking their tension on me, My dad always wanted to be myself very emotionally strong.
Strong. That
He
is
had
very
taught
important.
me that.
Yes,
He had
yes.
taught me that.
Means you say ki 8 chemos and 15 radiation in a. So did you suffer any side effect? Do you want to specifically mention about it, and
Yeah.
what remedies or what
Yeah.
things you have done to
Yeah.
combat these side effects?
Yeah.
Please tell my viewers.
So immediately after surgery, your stomach is already your gut is already in a bad shape. The stomach is so. I'll thank again Dr. Tushar Jadhav, who gave me a quite expensive live bacteria vials. They were pretty expensive.
That is gut bacteria.
For the live bacteria. He gave me live bacteria. I was taking that every day because even these foods, the natural foods may not be enough.
Correct.
They may not be enough even if I take. So I am already getting prepared myself for the chemo.
Chemo.
I'm keeping my gut ready for the chemo.
This we can call as a prep.
Prep, how you are getting yourself a
Yes.
defense mechanism ready for the drugs to
Correct.
invade the virus.
Virus.
Or whatever it is.
Yes.
So one thing I remember is I used to have chas instead of, and small meals throughout the day, and mostly chas and some fermented kanji and these vials plus the mostly fermented food. I used to have mostly fermented food, the kanji in a pot, pot made in clay pots, and the next day used to have that kanji, rice porridge, fermented rice porridge.
Yes,
That is one lot of coconut water, and this is what I had just after surgery, because healing is the first thing you are thinking of.
Yes, correct.
And then when you have the first chemo is difficult, but then you are given a drug so that you don't vomit. So that will take care of your vomiting part. So after surgery I vomited, but after chemo they will see to it you don't vomit.
Yes.
They give you the first anti-emetic drugs are given to you.
That is called pre-medications.
Yeah. So first they put in that So that is how it went. And by second or third chemo it is fine. If you follow a good diet regimen, it is fine. Like you have some fruits, you take it, don't take too many advice. You just follow what your body wants. You just be more focused on your body rather than somebody else.
Maybe you know better
of course.
what to eat and not to eat. And these benefits, this benefit you not.
Yes, that is what I am saying. You shouldn't wait for things to happen to you. That is why nutritionists and dietitians are always advising you, bring up your kids in the right way. In an early stage itself, you tell them that your body should be prepared for anything. And then I had a lot of microgreens. I had a nice windowsill farming. I had kept different kinds of microgreens. I used to add in sambar, dosha, everywhere I used to add this microgreens. So I think it helped a little bit. So second, third chemo it's fine, but by the time your chemo increases, you will start noticing whatever you never had, like your cholesterol might trigger up. All that can happen. So they will put you on those cholesterol lowering drugs.
Okay.
That time they might put you on.
And what about the radiations?
Radiation happened after chemo. Again, some time period was given to us. I don't think they put me. Even the very next month they put me on a radiation. So radiation was fine. During the radiation it was fine. Like I could go on my own, get myself radiated. I used to go back to my workplace. It was all fine. But after 1 month you will see it is like it is little difficult. Because by then the whole area would have blackened. It is little difficult. It is like a burnt area. Burnt feeling you will get only after later on. And if you are keeping yourself occupied and you don't think of it and lie down on bed, it is fine. They'll give you some creams to apply and all that.
Some moisture.
But that too, by then you are all right, you know. So
Okay.
you are even ready. Your body is ready to take it.
Take it.
Because chemo is over, your surgery stitches have all healed. Then I used to have more of vitamin C kind of fruits and vegetable, lots of strawberries and all that. You know? I used to have more of that, thinking that it would heal my healing process.
Yes.
But otherwise, your appetite was good enough. I used to feel like eating.
Okay.
Yeah. One thing I would like to thank again my surgeon is they had inserted a chemo port. That was also a new device for easy access of.
Yes.
Instead of pricking my nails, they had already had a port inside my body.
Okay.
Which helped me my chemo process very good.
मी माझ्या दर्शकांना म्हणजे व्ह्युअर्सला हे सांगू इच्छिते की किमो पोट म्हणजे मोस्टली छातीवर इथे एक इन्सिजन देऊन तिथल्या वेन्समधून ते पोट टाकलं जातं. 6पेक्षा ज्यांना जास्त किमो दिले जातात त्यांना किमो पोट यूज करतात. कारण किमोथेरपीचे ड्रग्ज असतात ते इवन आपले जे रक्तवाहिनी असतात त्याला सुद्धा डॅमेज करतात. पण किमोपोट असं असतं की ज्याला तुम्ही फ्लश करू शकता आणि प्रत्येक वेळेस तिथे किमोथेरपी त्या पोटमधून चढवली जाते आणि हे पेशंटला खूप कम्फर्टेबल असतं. द पोस्ट रेडिएशन यू हॅड दॅट ब्लॅक कलरेशन सिस्टेमिक रिॲक्शन्स लाईक यू नो दॅट टाइम यू हॅड अ fever or body ache or nausea or something?
Nausea was not there. I didn't suffer any other problems. Those other survivors also said the same thing.
Okay.
Like we were all having a good time at the hospital waiting for the radiation, and we just go home and come back. And we used to have biscuits or chai or whatever we feel like. I could see others also enjoying.
Achha.
By then you are quite in a stable condition by then.
Good.
Only thing you don't have hair and you may look a little bit weak. You will look little weak, but otherwise your body is still functioning fine.
Okay.
And still radiation is also nothing to fear. You have to just go there, one machine will come there, throw some light on and you are done. And I just went back because somebody said they are all going back to work. In US and all, people go back to work.
Yes.
So that also motivated me,
Yes.
So it's not something that you need to come back. I didn't come back and rest or anything. So when you are active, you feel like eating also. You feel like your appetite also will increase.
Yes. So you had tried any other therapies, like someone try yoga, meditations, Reiki, or acupuncture, any kind of things? Have you tried for during this cancer journey?
Slow exercises every day I used to do.
Okay.
Not exactly yoga, but I used to do those we have been recommended some hand exercises. That I used to gently do. And walking. And alternate therapy, no, I didn't go for any alternate therapy. I just decided whatever the medical team advises me, only that I will do. So they're keeping myself very happy. The emotional, mind exercises. Good
Mind exercise.
Mind power, I would say.
Any type of like hobbies or anything you have pursued that time?
Yes. Throughout chemo, I was only doing my hobbies.
The moment the chemo started, it was lockdown. I was also passionate about hobbies. I started making tea coasters out of old CDs. And I was already getting orders from all my friends. Priya, please give me this. So I used to decoupage, it's called a decoupage art, and I loved any kind of artwork. And I had enough work in my association.
Yes.
I used to go for this meeting with these 2 bags. So then once when I went to Mumbai, I saw smarter ladies who were in the theatre carrying smartly with a nice bag, wearing nice scarves, and so all these are motivations.
Motivation.
Why should I think and crib? And I really enjoyed going out and going for meetings. Maybe in the chemo I was even writing reports. So this didn't allow me to think that I am suffering. Don't feel like I didn't even lie down with pain, not a single day. I was so immersed in my hobbies and with my work. So there was no topic, there was nobody discussing about it unless I am in the clinic with my doctors. I want to thank Dr. Sandhya for her wonderful job in empowering women and giving support to a community of survivors.
मित्रमैत्रिणींनो, कॅन्सर सर्वायव्हरची स्टोरी काय ऐकायची? मी सुरुवातीलाच म्हटलं, पुढचा स्टेज मागचा शहाणा. ह्या स्टोरीवरून आपल्याला बरंच काही शिकायला मिळतं. कॅन्सर ट्रीटमेंट बहुधा सगळ्या कॅन्सरमध्ये थोडीफार सेम असते, फक्त त्याचे सेशन्स कमी जास्त असतात. म्हणजे सर्जरी होऊ शकते, केमो आहे, रेडिएशन आहे, सगळं आहे. तर ह्या प्रवास तो व्यक्ती कसा करतो, ह्या प्रवासामध्ये जे काही खास खळगे त्याला आढळले, त्याला पार कसं केलं, हे जाणून घेणं खूप आवश्यक आहे. पेन आणि सफरिंग म्हणजे वेदना आणि त्याचा त्रास होणे ह्या वेगवेगळ्या गोष्टी आहेत. म्हणजे वेदना सगळ्यालाच होतात, पण त्या वेदनेचा त्रास स्वतःला करून घ्यायचा की नाही घ्यायचा ह्या त्या प्रत्येक व्यक्तीवर अवलंबून असतं.